I think the foam models are very good because they're very realistic, and they make for the surgery that we actually practice. We don't see the whole bone when we operate on someone. We only see the part that is visible through the incision. So the foam model gives you this, and then you can take the foam off and see how accurate you were in your surgery. So it's really, foam models have been a great progress.
The foam at the beginning was a real foam. Now it's more realistic. It's difficult to be just like human skin, but it's more realistic. And then they came with the windows. So now we can have an X-ray view of what we're doing there. And now we have the nerves, we have the artery, we have the tendon. So it's getting more and more anatomical specimen, but it is synthetic. It's man-made. The foam has no intention to mimic or to substitute the skin. It's a way for them to do the surgery as we do, not a naked bone. We need to use the spreaders, we need to do the incision at the right place. We're not able to see everything in the bone. We just cannot turn your head and see from behind the bone or turn your head to the other side. No, there's a skin. So this makes the exercise more realistic.
You mentioned the foam models. Are they an added value for the training for the participants?
Yeah, that's for sure. This limits our view. This comes closer to reality, but that's the only thing. It's the limitation of the approach, which represents the reality, but we don't have the anatomy. We have some aspects of anatomy in several models, for instance in the MIPO courses, where we have some nerves going around the bone. We can simulate somehow.
Well, normally if you just have the bone, and that's what we had at the beginning, you see the fracture, you can look at from every side and you can do it. Whereas if you go with the foam, you work through a smaller incision, you don't see the entire bone, and that part is definitely better.